Was. I'm not sure if this was addressed or not, but I went to my doc a few months ago for HRT and left with birth control. Is that the same thing? 10 years on the birth control pill seems so long.
Yeah, so birth control is not the same thing. And unfortunately, too many OBGYNs feel comfortable, and even family doctors feel more comfortable giving you birth control than actually talking about HRT because, frankly, they've been prescribing birth control the majority of their career. And so they know it, they have a comfort level with it. But birth control hormones are synthetic hormones that are formulated to completely suppress your body's own um, pituitary access with the ovaries and to suppress your own ovulation and reproductive function. So that's how they work by giving you enough hormones so that your body is not creating the same amount on their own to suppress and to keep your ovary from releasing that egg. So think about that. When you're menopausal and your hormone levels are low, do you want to take a synthetic hormone that's going to suppress what your ovary's doing naturally in addition? So no, HRT would work better because we're giving your body back the hormones that it's no longer making in adequate amounts to bring you back to a level where your body can function better. So a lot of women get birth control just because it's easy. The doctor feels more comfortable prescribing it, but it's not the ideal treatment. It might help with some of the symptoms slightly, but overall, it's not going to get to the core of the problem, and it's not going to replace your estradiol levels.
So what if somebody has an IUD? What would a doctor do if, say, you already have an IUD in and you're not going to have it taken out yet, but you want hormone therapy? Is that something that you can do?
Yeah, absolutely. So there's various different types of IUDs. Like, so there's non-hormonal types of IUDs like the Paragard, or there's hormonal ones like the Mirena or Liletta. All the hormonal ones have progesterone embedded in them. So we use them for treatments for heavy periods, for painful periods, but also for contraception. But if you have a progesterone IUD, typically that progesterone is only released locally into the uterus. It keeps that lining thin. So honestly, it's kind of nice because if you're going to go on estrogen, anytime a woman goes on estrogen and has her uterus still in place, she needs to take progesterone with it. Estrogen has so many beneficial effects throughout the body, but the one negative thing it can do is it makes that lining of our uterus fluff up and get ready for a pregnancy, that estrogen level. So you need the progesterone to counterbalance that to keep the lining of the uterus thin. But if you already have a Mirena or a Liletta or Skyla, hormone embedded IUD, that's already doing that job for you. So in that sense, you would only need to take estrogen if you already have a progesterone IUD because the progesterone IUD can provide you with the protection that you need.